promise, I swear. Wherever you go, just always remember that you got a home for now and forever. And if you get low, just call me whenever. This is my ode to you. Wherever you go, just always remember you're never alone. We're birds of a feather, and we'll never change no matter the weather. This is my ode to you.
Excuse me. Today I am 26 weeks and 5 days pregnant, so almost 27 weeks. A little confused. I know there's like different accepted ways of when the third trimester is. I can't remember if it's 26, 27, or 28 weeks pregnant. Either way, I'm just about there. So we are kind of in the third trimester right now, which is just insane. I've really just been really thinking about, and I've said this before, and I'm sorry if it gets old, but it really is remarkable how strong Henry is. I mean, he's the baby that's not supposed to be here, and here he is. We're in the third trimester. He's doing great. So some things that have been happening this week that I have to talk about are, number one, acid reflux has started happening. Not so much heartburn. I don't eat like super spicy things. I eat things that are like a little sour and a hint of spice, but I can't really handle spicy foods, so spicy to me is like probably normal to another person, if that makes sense. So I'm not really eating anything that would give me heartburn. However, at night, the acid reflux is for real. I have now started to sleep with 2 pillows propping my head up, because otherwise if I sleep flat, I will wake up in the middle of the night with like the most excruciating pain in my throat ever. So that's happening. Another thing that has been happening is earlier in the week, it happened for sure 2 nights in the row. It might have been 3, but for sure 2 nights in the row. My legs, it would alternate which leg happened. My leg would like stiff up, and like I got a really painful Charlie horse. Like the first time it happened, the pain would not go away for seriously like 30 minutes. And I tried showering, I tried walking on it, I tried massaging the muscle. It just made it worse. So because of that, I told my mom, and I was like, Mom, I cannot deal with these Charlie horses until I give birth, because I did experience Charlie horses when I was pregnant with Charlie. But I don't remember it being this early. I remember it being a little bit further along in my pregnancy, but I do remember it being a pretty consistent thing. And I really didn't want to do it this time around because it's really painful. It like wakes you up from your sleep and you're in pain, you know? So my mom suggested that I start taking these. So we went to Costco, getting extra calcium pills or supplements. They're like little chewable things. So I'm taking 2 of those every day. I also am taking 1 magnesium supplement. I do this one every other day because it does kind of upset my stomach a little bit. But since I started taking those, I haven't had any Charlie horses, which is awesome. And then if I absolutely feel like I really like need the extra calcium, I will take Tums, which also helps with the acid reflux that I've been having. So those 3 things I have started taking, and they seem to be helping. What's kind of sad is that, so at night, if I could feel when I was going to get a Charlie horse, because the like muscle in my leg would like really tense up, and so I was like sleeping in like one position and trying really hard during the night to like not move in that position, from that position, because I toss and turn really bad at night. I just have always been that way. I'm constantly changing positions. It has only increased with being pregnant because my belly, you know, with him moving, I need to get comfortable. So those couple nights that I was experiencing the Charlie horse things, I wasn't really sleeping that well because I was really afraid to go to sleep and like potentially move a position and wake up in the middle of the night in really bad pain. Like it really hurts. I'm not kidding. The first time that it happened, I like jolted up from my sleep, like smacked Matthew in the face. Like it was bad. I was like in tears. But since then, like I said, everything's been fine. We're doing really good. Another thing, it's not pregnancy related, but just so that you guys know, we had a birthday this week. Charlotte turned 3. I'll try to include a clip of her blowing out her candles because it was so cute. I can't believe that my little girl is 3 years old. I mean, just wow. And then I have a doctor's appointment. I believe that I shared with you guys that I moved it to Saturday. I am considering moving it back to Tuesday. I'm going to see if they're able to get me in on Tuesday. If not, I'll just stick with my Saturday appointment because I do kind of want to see him. I've never had an ultrasound this late in pregnancy. The furthest ultrasound that I had when I was pregnant with Charlotte was 22 weeks, so I'm about to be 27 weeks. It'll be nice to see exactly how chunky he is and all the different stuff that he's doing. So I'm really, really excited for this ultrasound. And then they're also doing the glucose test, which I told you guys I am a little bit concerned about because although I didn't have like pretty much any complications when I was pregnant with Charlotte, because of the fact that there is the weight gain this time around, I am concerned about it. Which also just brings me to the regular weight gain point. I don't have a scale, so I haven't weighed myself, but my appetite has like definitely increased. I have the hunger munchies strong. So I am not at all worried about that I'm not gaining enough weight, like at all, like not even a little bit. And yeah, Henry's just being really active. He definitely feels really, really big. And I've shared this before for several weeks. At night is when he moves the most. And at night is when my belly just feels gymumbo, like huge. I don't know what he's doing in there, but I feel huge at night, like huge. I'll have more to share after my doctor's appointment. If you guys have any questions, please feel free to leave them below. I will answer them to the best of my ability. And yeah, thanks so much for watching. Take care. Let me show you my 26 week, almost 27 week belly. Here it is. Front and other side. All right, thanks so much for watching, guys. Take care. Bye.